Hi, Dr. Andrea Maxim, naturopathic doctor, and hopefully you're naturopathic doctor already. And what I wanted to discuss with the live blood analysis. So every patient that walks into my office will have this done at least once. And all we do is we just take a small drop of blood from your finger, I put it under my microscope, and I can show you on a TV screen exactly how your blood is flowing, what your red blood cells look like, what the plasma or the environment of those blood cells look like, and if there's anything going on in the system that we need to start treating. First and foremost, I'm always looking for underlying infections like parasites or yeast. And it's amazing how many patients, I would say at least 70 if not 80%, will have some sort of an underlying infection, which could be the root cause as to why they're not feeling well. Low energy, skin issues, chronic digestive issues. So this is something I definitely encourage you to get done with me, of course, but whoever you have close to you, because it is such a wonderful tool, and it's not very often that we can actually do a lab test in office and get the results right away, right in front of your eyes, and see the quality of your body. And it's something that we can retest often, and it's amazing how even just dietary changes can improve the quality of your blood. So I'm going to show you a few examples of what the live blood looks like so that you can see if maybe this would be something you would like to do, or you definitely will do with me in office. Here's the microscope that we would be using, and right next to it is a TV screen where you and I can both see the quality of your blood, the quality of the blood flow, are there any infections, and then we can discuss our course of treatment all right before your eyes and in my office. So here we have an example of what healthy blood would look like. All the red blood cells, those little circles, are all nice and spread out. They're not clumped on top of each other. There's some nice black background going on. Here we have, again, a healthy specimen, but with some B12 deficiency. The B12 deficiency will show up as those little donuts inside the red blood cells. Now in this example, we're seeing a little bit more clumping of the red blood cells, and the background is not nearly as clear. And this is what it can look like if there's chronic inflammation, either from stress, from diet, from toxic exposures. All of these can cause the red blood cells to become more sticky and not flow as nicely. Now for underlying infections, I commonly see yeast, like what we're seeing here with those bright white circles in the background. You can see them here in and amongst some of that liver toxicity, that kind of bundle of spider webs. And parasites are like what we see here with those spiky borders, or they kind of look like a bombshell. And the examples here are probably the worst parasite infection I've ever seen in a patient. Very large, very active, and this patient needed a lot of support. And finally here, we have the main reason why I got into live blood analysis, and it's for these wonderful immune cells we're seeing here. I love to see them actively moving like little amoebas. That's exactly what we're seeing with this patient, and hopefully we'll be seeing that with your blood. So I've shown you a few examples as to why live blood analysis is so wonderful and why I love doing it with every single patient in my office, because if for nothing else, it can show you all the hard work that you've been doing and how much it's improving on the inside of your body, not just on the outside. I do want to preface this video with the fact that live blood analysis should not be used as a diagnostic tool. It just gives us an insight into some other things that we need to be investigating. So never use live blood analysis as the be-all end-all when it comes to treatment, unless you're taking in symptoms, signs, and potentially other lab testing that you've done. But I definitely look forward to doing this test on you in my office, or please look at people in your area that do it as well. I'm Dr. Andrea Maxim. Have a happy and healthy day.